My name is Winifred and I'm studying Health Data Science at the University of Birmingham.
Hi, my name is Dana Rose. I study Health Data Science at the University of Birmingham.
Health data science is important for the future of healthcare because we are generating larger sums of data and amounts of data from electronic health records to genomic and metagenomic data, which we can use to improve treatments and inform public health decisions. So it's really important that we are studying health data science.
I have learned programming languages, mainly Python and R, a little bit of Stata as well as SQL. I've also learned statistical modeling and mental capability. I didn't know that my brain could stretch this far.
What we do in Masters in Health Data Science is combining the theoretical background that is needed with practical skills in order to prepare you better for your future career.
In Health Data Science, we are interested in understanding and in developing methods to extract meaningful patterns from complex health data science. And these computational methods that are now newly developed, such as, for example, artificial intelligence, do exactly that, but in a more powerful and effective way. And in essence, this brings us closer to the dream that we have in health data science, which is precision medicine, right? Where we are able to extract insights from data and applying in a meaningful way to support patient care.
So on this course, we are taught through a range of lab and lecture sessions where we are taught to apply the concepts that we have learned throughout the lectures. My favourite module so far was the first one, the Foundations of Computing in Health Practices. And that's because it's the first introduction to coding and programming, and it's a bit like diving into the deep end. It really does build the necessary skills that otherwise I probably wouldn't have had, especially coming from a non-programming background.
This program is suitable for a wide variety of students, as health data science sits in the intersection between medicine, statistics, and computer science. And so we welcome students from a diversity of backgrounds, from doctors all the way to computer science, or others with a quantitative or healthcare experience. Something that I think students really value is the research project that we have at the end, which is the thesis module, where they get to work in real case scenarios alongside faculty, so they learn what is going on in the field.
Health data science intersects between medicine and technology. A lot of health data is unused, and when we employ it, we can use it for personalized medicine, improving health outcomes, and improving treatment decisions.
The course is very hands-on, and assessments are often coursework-based, like presentations, where we build on skills that can be transferred into industry or research.
Students will graduate with a breadth of knowledge, both in the technical and practical sides. They will end up with programming skills with both in Python and R, as well as some SQL basics. Then they would also have machine learning and statistical fundamentals.
I plan on re-entering the workforce as a data scientist or going back in the academic setting, maybe pursuing higher education through a PhD or just working full-time. Health data science is the future of healthcare, and at Birmingham, we are forging the path.